You're dealing with an L4-L5 or L5-S1 disc bulge, you know how painful and frustrating it can be. Simple things like sitting, bending, or even getting out of bed can suddenly feel impossible. The good news is that most disc bulges can actually heal without surgery, and there are some key things you can do to help the process happen faster and more effectively. In this video, I'm going to share with you 4 ways to speed up your recovery, reduce strain on your lower back, and help you move with more confidence again. Now, these are the same strategies that I use with my patients in practice here. Hi everyone, I'm Dr. Craig from Chiropractic in Auckland, and before we dive into the 4 tips, I want to explain a couple of important ideas first. I found that when you understand why you do something, you're much more likely to stay consistent with it, and that's where the magic happens. Now, if you'd rather just jump straight to the tips, feel free to skip ahead. I won't be offended. So the idea behind these 4 steps comes from a concept that I often talk about with my patients, and that is habits before exercise. Now, of course, with the disc bulge, you will need to do some exercises to help with the recovery, and I'll be making a video or 2 on those soon. But I always ask my patients, what habits do you think have got you here in the first place? You see, most disc bulges don't just happen overnight. They develop gradually over time, and then one small movement or activity tips things over the edge, and that's when it becomes painful. There are often daily habits that you may have that put extra load on your lower back, and if we don't address those first, even the best exercises may only bring short-term relief. So these 4 things I'm about to share with you are designed to help take the strain off of your lower back and create some good healthy habits so it can start to heal and function better without being aggravated all of the time. Now, I hope that makes sense, and if you have any questions about this idea, please drop them in the comments below. So the second thing I want you to be aware of is that there is a continuum when it comes to disc bulges. You know, at one end we have people that have disc bulges but no pain. In fact, quite a high portion of the population have disc bulges and yet no pain. A study from 2015 in the American Journal of Neuroradiology found that 30% of people in their 20s had disc bulges and no pain, and this increased with age. For example, 60% of people in their 50s had disc bulges and no pain. So actually, disc bulges are actually pretty common. Now, as we move across this continuum, we have people that may have disc bulges and just a little bit of localized irritation, a bit of lower back pain. And then at the other end, we have people where there is a disc bulge that happens to be contacting or compressing a nerve that's giving you that classic sciatica, that pain and numbness and weakness down in the legs. So the key takeaway from mentioning this is just because you have a disc bulge doesn't always mean you have pain, and there may be other things that could be a pain generator for you. All right, without further ado, let's dive into these 4 tips. So our first tip here is to avoid flexion-based postures. Now, this is that bending forward or being in that rounded, flexed forward or rounded back position. So if we think of how our disc works, we have our outer layers of our disc, and we have the inner nucleus, which is like a jelly substance, and that creates that shock absorbing nature. Now, if we bend forward like this, what happens is it usually forces more of the fluid in the disc backwards. Now, if we had a disc bulge that was irritating something, this could potentially make things worse. This is really important to do in the morning. One thing you may not realize is that our discs actually swell overnight. They absorb fluid from the vertebrae above and below overnight. So they're the biggest they're going to be first thing in the morning. This is often why we are a little bit taller in the morning than we are in the evening. Now, if you think about it, if our discs are swollen, we have a disc bulge that's irritating a nerve, and then we wake up and the first thing we do is bend over and touch our toes, we are potentially going to be making things worse. So what you want to try and do is just be mindful of that, and at least don't bend forward until you've been up and about for half an hour to an hour. So what you can do instead is, rather than rounding through our back, is we can do a movement called the hip hinge. So this is one of the most foundational movements we should practice. This is where, rather than rounding our back when we bend forward, we're going to keep our back nice and straight and stable. We want to hinge through our hips. Now, this will take a lot of the load off the discs and muscles in your lower back and put more of the load through your glutes and hamstrings where it should be. Now, as a little aside here, is I've got a bit of a disc irritation which I flare up occasionally, and one of the worst flare-ups I had was I was bent over doing something and I sneezed, and that wasn't very good. So make sure you don't sneeze when you're in that rounded position. So times to be mindful of this flexed or rounded back position is things like brushing your teeth. If we've bent over our sink, brushing. If we are leaning over the kitchen bench preparing dinner. If we're out in the garden, or we're cleaning, or we're sitting on the ground leaning over playing with the kids. This is the most important times to be mindful of that rounded back position, and just try and think, can I keep my back a little bit straighter? Can I take some of the tension off of my lower back? Now, I want to finish off this one by saying rounding your back is not bad. It's a normal idea. We should be able to bend over and round our back and touch the ground. But if you have an irritated L4, L5 or L5, S1 disc, rounding like that can potentially make it worse. So we just want to be careful while it's acute, but once things settle down and you're getting back to normal, you can get back into some of those other movements quite happily. So our second tip here is all about sitting. Now, most of us have to sit for work, or we'll spend a lot of time sitting in the evening if we're watching TV. And if we're slouching in our office chair or on our couch, we're essentially being in that rounded position like I just talked about in tip number 1. So what you can do instead is, if you're sitting in your office chair, you can sit all the way back so that the back of the chair's giving you that lumbar support. If your chair doesn't have enough lumbar support, you could use a rolled up towel or some sort of posture pillow. There's lots of different options around to give you that lumbar support. This is especially important when you're driving in a car. Car seats are notoriously bad for allowing us to go into that slouch position while we're driving. So making sure we scoot our bum back, use that lumbar support, or if your chair doesn't have enough, use that pillow or rolled up towel. You can also look at tilting the base of your chair forward at work. If it's adjustable, we want to try and sit so our hips are a little bit higher than our knees. This allows our pelvis to tilt forward. It allows us to sit in that straight back position with less tension across our lower back. And when you're at home, what I often suggest is sitting on a chair with a straight back, like a dining type chair. Things like couches and lazy boys and recliners generally put us into that rounded position, which if you've got an acute disc, it's not very comfortable. And the final thing is regular breaks. Whether you're at work or whether you're at home, you want to make sure you get up and have those regular movement breaks. And this is tied in with our third tip. So our third tip here is regular movement. So regular movement is vital. It lubricates joints, it blocks pain, it loosens up tight muscles. So you want to make sure you have regular sitting breaks, whether you're at work or on your couch. You want to go for short, gentle walks. Just be careful walking uphill. You might find that walking uphill is a bit aggravating for an angry disc. It tends to make us lean forward, like tip number 1, and that can make things feel a little bit worse, but nice, gentle walks. We can do gentle movements like the yoga exercise, the cat-cow or camel, cat dog, whatever you want to call it. One of my other favorite exercises I call is the circle exercises. This is where you can do like nice circles with your pelvis, 10 in one direction, 10 in the other. We can then keep our pelvis still and do circles just with our spine only, 10 in one direction, 10 in the other. Very important with these is to make sure that you stay within your pain-free range. If we keep doing painful things, we keep that level of threat in our system high, so our pain potentially may stay around longer. So you can also use these as a good way of monitoring your progress. You might find that with your cat-cow, like today I can only go this far, but next week I can go this far, so things are improving. And that can really help with your outlook on your recovery. And our fourth and final tip here is all about sleep. So sleep is vital. This is when our body recovers from an injury. So we want to make sure that we're having good quality sleep. Now, sleep positions can irritate your back a little bit. So if you're a side sleeper, we can pop a pillow between your knees. This will help that top leg dropping down. It'll also stop it from dropping your top hip over and creating that torsion or twisting through your lower back, which can definitely irritate things. If you are a back sleeper, you can lie on your back with a couple of pillows under your knees. Again, this will just take a lot of that tension off of your lower back. This is kind of like a paired back version of one of my favorite positions called the static back position. This is where you lay on your back on the floor with your legs up onto a chair or a couch. This really takes a lot of that tension off of your lower back, and a lot of people I show this to really love that position. And the final part here is getting out of the bed with an angry disc is often quite sore. First thing in the morning, our backs are stiff, we haven't moved all night, so our muscles are tight, the joints haven't been lubricated, our discs are swollen like we talked about, so getting out of bed can be a bit of a struggle. So we don't want to just try and sit up and just force ourselves out of bed. What you can do instead is you can move to the edge of your bed, we can roll onto our side, make sure your core's on so our backs are nice and stable. Then when we're on our side facing the edge of the bed, we can then push ourselves up to a sitting position. As we come up, we're going to keep our heels together and drop our feet down in front of us, and now we're sitting on the edge of the bed. Then we can keep our back straight, keeping in mind that hip hinge type position, and we push up through our legs. And this is a way that we can stand up out of bed with minimal strain on our lower back. So there you have those 4 ways to help speed up your recovery from your L4-L5 or L5-S1 disc bulge. Now, as a quick recap, we want to make sure that we avoid those flexion-based postures. We want to be mindful of how you're sitting. We want to get in your regular, safe movement breaks, and also we want to be aware of your sleeping positions. Now, it's important to realize that healing takes time, but it also takes the right habits. And if you apply these 4 strategies consistently, create some good, healthy habits, hopefully you'll build a stronger foundation for long-term recovery. Now, if you found this helpful, hit that subscribe button and feel free to share it with someone you think could benefit from it.